Yeah, I'll adjust it all. Go try that.
Cool.
Hello.
Come in.
Hey, how's it going?
Hey, good. How are you?
I'm doing good, thanks.
Good.
What's your name?
I'm David.
You're Dave?
Yeah.
I'm Tim.
Tim, nice to meet you.
Paramedic student here with the fire department. So,
Awesome.
what brings you in today?
Just coming for a general checkup.
Just general checkup?
Yeah.
Any concerns or anything you
No.
have right now?
No, not really. Not at the time. Pretty healthy.
Okay.
But yeah, just
So,
want to get checked out.
do you mind if I call you Dave the rest of the time?
Yeah, absolutely. That's
All
fine.
right, Dave, tell me a little bit about yourself. How old are you?
I'm 24 years old.
24 years old?
Yeah.
Perfect. Okay, so the way this is going to work is I'm just going to do a couple questions about your history, get some information about you,
Okay.
and then we'll go through and just do a pretty thorough head to toe.
Okay.
We'll do all your neurological assessment, things like that, musculoskeletal,
Okay.
respiratory, cardiac, so all the body systems, make sure everything's working fine. If you have any concerns or anything throughout the thing, just let me know, and we'll go from there.
Sounds good to me.
All right?
All right.
So I guess what we'll do is we'll start off with just some history about you. So
Okay.
what's do you have any past medical history? Any major surgeries? Any heart problems, breathing problems, diabetes? Any major concerns you have?
Not really. I'm previously healthy, pretty active.
Pretty
so,
healthy?
Yeah.
Okay, perfect.
Yeah.
Do you have any allergies?
No allergies that I know of.
No allergies? To medication, food, anything at all?
Nope, none that I know of yet.
Okay, perfect. Sounds good. Taking any medication? Any prescribed over the counter, herbals, anything like that?
Just some multivitamins once in a while.
Multivitamins?
Yeah,
Cool,
other
okay.
than that, no. Maybe the occasional Advil or something, but nothing.
Sure. Okay. When did you last eat?
I ate lunch.
What'd you have?
I had a hamburger.
Oh, nice. I'm hungry.
Yes. Yeah.
And what were you doing before you came in here today?
I was just cleaning, actually.
You're cleaning?
I was, yeah.
Oh, that's good.
Yeah, it was, yeah, productive. Yeah.
Right on. Sounds good. So you sound like a pretty clean bill health guy.
Mm-hmm, yeah.
So a couple more questions. So
Okay.
your family history. So in your family, do you have any history of medical problems, heart problems, heart attacks, strokes, CHF, COPD, anything like that in your family?
None that I can recall. No, my parents are both healthy. And,
Okay.
Yeah. My grandparents are still
Any
healthy,
cancers?
So. No, none that I know of. Maybe like distant cousin, but
Okay.
Nothing really
Nobody
close
immediate?
to, no one immediate. No.
Okay, perfect. So how about your social history? So what do you do for work?
I am a lifeguard.
You're a
Presently.
lifeguard?
I am.
Oh, right on. How's
Yes.
that?
It's good. Yeah, it's a lot of fun. It, like I said, keeps me pretty active. So it's
Nice.
Yeah, it's kind of cool that way.
Sounds good. So a couple more questions, just so you know,
Yeah,
this is all confidential and personal.
Okay.
It's between you and me.
Okay, cool.
Do you drink at all?
Occasionally, yeah,
Yeah.
I'll have an occasional drink, maybe once every 2 weeks. Glass of wine with my supper and stuff.
So glass of wine every couple weeks.
Yeah,
Okay.
yeah, maybe like 2 weeks. So
Oh,
I'll have
perfect.
a glass
So
of
just
wine.
a casual.
Just
thing.
casual kind
Okay.
of thing. Yeah.
Any recreational or street drugs?
No.
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 Never.
No, I
Okay.
can't. Not with what I do. So.
Perfect. Yeah. All right. Sounds good. So that kind of gives me a little bit of information about you. So
About me?
that's your
Okay,
history. So what we're gonna do now is we're just gonna go through and kind of do our, like I said, a pretty thorough head to toe.
Okay.
And I'm gonna assess all your systems and
Yep.
things like that. So we'll get started here.
Cool. Sounds
All right.
good.
I'm just gonna grab me some gloves.
Alrighty.
So before we get started, do you have any other questions or concerns?
No, not really.
Any pain or anything anywhere?
No, a little bit sore from the gym, but other than that, it's about it.
Pretty normal for you?
Yeah, pretty normal.
All right. So first thing I'm going to do is I'm going to get a full set of vitals on you.
Okay.
So if you don't mind, I'm going to get you to take off your shirt.
Okay, yeah.
I'll just lean this back a bit.
Sure.
All right, so I'm going to put this on your arm. Just going to measure your blood pressure.
Yeah, no problem.
just slide this onto your finger on the other side.
Okay.
So this is just going to measure how much oxygen is in your blood.
Okay, cool.
Perfect. So lean back for me. Make yourself nice and comfortable.
Okay.
All right, I'm just going to take your blood pressure, so you're going to feel a squeeze on your arm, okay?
Okay, yeah, no problem.
And then, while that's doing that, I'm going to get a BGL, so measure your blood glucose level.
Mm-hmm.
So if I can borrow a finger from you.
Yeah.
So I'm just going to clean the area first, make sure there's nothing in the way there.
Okay.
And then I'll just do a quick little poke here. Put that in my sharps. Alright, and then take a little sample of your blood here.
Sure, yeah.
Great, so your sugar is 5.6, which is perfectly normal. So
Yeah,
that's
okay,
good to
cool.
see.
What's the normal range?
Normal range is 4 to 8.
4 to 8?
So anything between 4 to 8 we're very happy to see.
Pretty good?
Yeah,
Okay, cool.
so 5.6, you're right in the middle. It's perfect. So, blood pressure is 128 on 80, so that's perfect. That's perfectly normal.
Okay.
Your heart rate's 66. It's good. It's in the normal range. It's low, so that must mean you're in pretty good shape.
Mm-hmm.
Oxygen, you're at 98, which means you're getting plenty of oxygen to your body.
Okay.
So those are all good signs for us.
Awesome.
So one more thing I'm going to do here, Dave,
Yeah.
is I'm just going to do a 12 lead.
Okay.
So what a 12 lead does is it measures the electrical conduction of your heart
Yeah.
in different parts of your body.
Okay.
So basically I'm taking a picture of your heart is essentially what it's
Okay.
doing. So we'll just make sure that's all working properly.
Okay, cool.
So a couple stickers.
Mm-hmm.
Takes a little while to set up. But
Okay.
Mix these ones up here. So these first 4 leads are called your limb leads.
Okay.
Perfect. How old are you, Dave?
24.
24.
Yeah.
Perfect. So now, I got a couple more here for you. So these 6 are just going to go on your chest.
Okay.
Just let me get them all organized here. So we'll just do the proper placement on them. So second intercostal down, V1, come across and do V2.
This is all for the heart?
Yeah, this is all for the heart. So
Oh, okay.
what it does is basically lets us look at multiple different angles, about 12 of them,
Okay.
of your heart. So it takes actually a really thorough picture.
Okay, cool.
And then I'll explain to you what your 12 lead looks like after.
Yeah, no problem.
Just one under here.
Sure.
One more under your arm. And then last one here. Perfect. Alright, so just about to do your picture here, so I'll need you to sit nice and still.
Yeah.
Breathe normally. It's not going to hurt. Alright, and here we go. Alright, so I've got your 12 lead here, so I'll just have a quick look at it. Alright, so everything looks good. Again, your heart rate's 64, so you're still within the normal limits. It's a normal sinus rhythm, which means the heart's conducting in the proper sequence at the proper rate. So that's very good to see. So it tells me that your heart's doing perfectly fine, it's doing its job, it's nice and strong.
Okay.
Perfect.
Awesome.
So
sounds good.
I'll pull some of these off here.
Yeah, no problem.
Sorry about the stickers.
Oh, it's all good.
Here, I'll just turn this off. Get all this off out of your way. Perfect. Take this off. And then we'll get rid of this here.
Okay.
So I got one more vital to do, and I'm just going to take your temperature quick.
Okay.
So have you been feeling ill at all? Any colds, coughs, flus, anything recently?
I had a cold last week.
You had a cold last week?
Yeah, I'm getting rid of it. Sort of. Yeah.
Okay.
I feel pretty good now, but.
Did you take anything for that cold last week?
Some stuff, some Advil, and
Okay.
just the occasional.
Didn't go see a doctor or get anything prescribed to you or anything like that?
No, nothing prescribed. No.
Okay. So I'm just going to stick this in your ear.
Okay.
Just take your temperature here, okay? Great. So your temperature is 36.9, which is actually a very good temperature. It's
Okay.
pretty normal. So we'll
Not
do that. So if you don't mind, I'm just going to check your pulse here.
Okay. Yeah. No problem.
Great. And I'll do the other side.
Yeah.
Perfect. So your pulses are equal bilaterally.
Okay.
Also, at the same time I did that, I was checking your respirations. So
Okay. Cool.
it was about 12 breaths per minute, which is very normal for a healthy adult male. So that's your circulation, your airway, and your breathing. So those are our three main things we look for on a primary assessment.
Okay.
So other things I'm going to do here is I'm going to do a level of consciousness, so your neurologic exam.
Okay. Cool.
So a couple more questions here, and then we'll do some tests, test your cranial nerves and things like that. So can you tell me your name again?
David.
David, do you know where you are?
Yes. Yeah. I'm in Fort McMurray.
Yeah, do you know what date it is?
November 26th.
Perfect, yeah,
Is that what it is?
absolutely. And then can you tell me what you're doing today?
Just coming for a checkup. Like I said, I was cleaning earlier. I was about to go to the gym later on today.
Perfect, yeah, great on. So you're ANO by 4,
Okay.
which means you're not altered, you have a good level of consciousness.
Awesome.
So I'm going to just do a couple more little assessments. So
Sure.
close your eyes for me.
Okay.
All right, and I'm going to grab a finger and you tell me which one I'm grabbing.
Okay.
Which finger am I grabbing?
The one next to the pinky.
Perfect. All right, and on this hand?
The index on the right hand.
Perfect. You can feel me. What am I doing?
Rubbing it.
Perfect.
Yeah.
All right, I'm going to check your feet.
Sure. Yeah. Absolutely.
All right, which toe am I grabbing?
The one next to the big toe.
Perfect. And on this one?
The big toe. On the right
Perfect.
side.
Just make sure. So then, with your hands,
Yeah.
I'm going to get you to lift up for me.
Okay.
Press against my hands. Perfect. Push down. Perfect. Same with your feet. So pull your feet towards yourself.
Towards myself. Okay.
Perfect. And push down for me. Excellent. So that's just a quick little nervous system exam.
Okay.
So like I said, we're going to go a little bit more in detail here, and I'm going to assess your cranial nerves. So
Okay.
cranial nerves come off your spinal cord, out of your brain, and basically what they do is they affect everything that happens with your face, your eyes, your smell, your taste, your tongue, and your hearing.
Okay.
So we're going to do a couple of those tests. So
Okay.
what I'm going to do first is I'm going to get you to... Alright, here. So I'm going to get you to we're going to close one nair. So
Okay.
with one hand, close a nair and take a nice deep breath through your nose. Any pain doing that?
No. No pain.
Okay, and do the other side for me. Perfect. Any problems breathing in like that?
No.
All right. All right. So I'm now what we're going to do is we're going to do your optic nerve. So what I'm going to get you to do is I'm going to get you to cover one eye with this piece of paper here. And I'm going to look down the hallway. About 20 feet away we have our Snellen chart.
Okay.
So I want you to read the line from left to right for me.
Okay, so D-E-F-P-O-T-E-C.
Perfect. Any problems with that?
Nope.
Okay,
No
so now if you can cover the other eye.
Okay.
And I'm going to get you to read the chart from opposite side, so right to left for this.
Right to left, okay.
Right to
so
left.
C-E-T-O-P-F-E-D.
Perfect. Okay, sounds good. So that tells me you have 20/20 vision.
Awesome, cool.
So that nerve is working fine. So now we're going to go on. I'm going to check your pupils.
Okay.
And then we're going to check your 6 cardinal fields of gaze.
Okay.
So just look nice and straight ahead for me.
Okay.
Perfect. Perfect. So your pupils are about 4 mils in reactive, which is very normal.
Okay.
So now I'm going to get you to look nice and straight ahead for me. And I'm going to do your 6 fields of gaze. So keep your head forward and just look at my finger, okay?
Yes.
And follow my finger.
I'll follow finger, sorry.
No problem.
Okay.
So follow my finger.
Okay.
Perfect. Down here. We're going to go straight up. Straight down. Up to the left, right. And down. Perfect. Any problems with that?
No.
All right. So moving on. So now I'm going to get you to stick out your tongue.
Okay.
Move it from side to side, up and down. Any problems with that?
No.
Okay.
None.
Now I'm going to get you to do a nice big smile for me. Do a frown, sad face. Clench your teeth nice and hard. Perfect. Any problems with that?
No.
Okay.
Sorry, I don't know how to frown properly.
That's okay. You're a happy guy.
I am a happy guy.
Perfect. So now what I'm going to do is I'm going to do your auditory nerve. So
Okay.
I'm going to get you to look nice and straight ahead again. Close your eyes.
Okay.
I'm going to whisper a word into each ear, and you got to tell me which word I'm whispering, okay?
Okay, cool.
What word did I say?
Banana.
Perfect. And we'll do the same on this ear.
Okay. Apple.
Perfect. So now keep your eyes closed again.
Okay. Yeah.
What I'm going to do is I'm going to rub my fingers beside an ear, and you
Okay.
just got to tell me which ear I'm rubbing my fingers beside, okay?
Okay. Left.
Perfect.
Right.
And again, awesome. Very well done. All right, so now what I'm going to do is I'm going to do your vagus nerve. So
Okay.
it's basically your gag reflex.
Okay.
So I'm not going to try and make you choke here, but I'm just going to stick this in your mouth
Okay.
and see if you have an active gag reflex, okay?
Okay.
So open up nice and wide for me. Perfect. And open up one more time for me. I'm just going to have a quick peek. Perfect. All right. And so the last one I'm going to check here is your spinal accessory. So I'm just going to put my hands here
Okay.
and just get you to shrug your shoulders for me. Perfect. Any pain doing that? Any
No.
pain in your neck?
Nope.
Perfect. All right. So that's your cranial nerve assessment.
Okay.
So what we're going to do now is we're going to go on to our thorough head to toe.
Okay.
So if you have any questions, we'll get started, okay?
Yeah, absolutely, yeah.
All right. So first thing I'm going to do is I'm going to check your head. So
Okay.
I'm going to check